Hello, I'm Mary Horgan. I'm a consultant in infectious diseases and general internal medicine at Cork University Hospital in Ireland. I'm also president of the Royal College of Physicians of Ireland. This year's ECCMID takes place in Vienna in Austria from July 9th to the 12th. It'll probably take a hybrid form for obvious reasons, but hopefully some of us will be lucky enough to travel there in July. I've been involved in ESCMID for quite some time and in the ECCMID organising committee. There are a number of things that I would like to highlight about involvement in ECCMID. Firstly, it's a great opportunity to meet old friends, but also to make new friends. It's an opportunity to network, see what other researchers are doing, what other educators are doing. And while COVID-19 and SARS-CoV-2 has been very dominant in our lives for the past year, all of the other infectious diseases continue to be a huge presence in our life. As somebody who practices infectious diseases, general infectious diseases, it's really important to keep up to date in all of the other aspects of infectious diseases. They haven't gone away, nor will they. So while COVID-19 has taken a huge amount of our time, a lot of the spin-offs from COVID-19 have informed our practices in the past year, but also will continue to inform our practices. When I look through the program, there are certain areas that really appeal to me and certainly would appeal to you as practitioners in infectious diseases, researchers in infectious diseases, but also to our trainees in the area of infectious diseases and clinical microbiology. As a practitioner in general infectious diseases, I'm also always attracted to the hot topics in areas such as bacteriology, fungi, travel-related infections. These always give a good overview of what's new in the area and are done so very succinctly by experts in the area. Other areas that appeal to me, there is a debate on mandatory vaccination for healthcare workers, the pros and cons of that. I think it'll be a very interesting debate. Again, it's come to the fore when it comes to COVID-19. And while it's been an issue for other illnesses, prevention of other diseases like hepatitis B and influenza, it has huge implications for keeping our patients safe given the high transmissibility of COVID, but does have knock-on effects for other infectious diseases that are preventable by vaccines. So that should be interesting. Clearly, the development of vaccines and the platforms around this has been huge in the past year. There is a number of topics on vaccines in various guises, which again will appeal to a broad audience, but also those that are research active in the area. The area of climate change and infectious diseases is something that's always an important area that we need to look at. Again, the past few years have highlighted the impact of climate change on infectious diseases. We've all seen it in the countries that we live in, and now more than ever, we need to not only learn about it, but advocate about the impact that climate change has on infectious diseases, particularly in vulnerable communities. There's an item on EU research policy and what impact it will have on infectious disease. I think this is incredibly important. Ireland being part of the EU is part of the network for research for infectious diseases. And I think there's an onus on all of us to continue to promote and advocate for funding in this very important area, not only in COVID-19, but really beyond that. and our ability to network, to know researches in common areas is really important. And ECCMID gives you the opportunity to link in with people who are giving it talks in clinical, but also in basic research in the area. There's a number of talks on areas that I'm interested in, which is the area of viruses. There is a symposium on hepatitis B virus. Is it a battle still worth fighting? We know the large proportion of infections from this virus that continue to have huge impact globally. And while we have a vaccine that prevents the infection, there are many infections that still happen. And the chronic nature of the infection has a big toll on many populations within Europe, but also beyond. So very interesting topic. The topic of viral infections in pregnancy is also worth listening to see what's new. And I would certainly encourage those that are interested in that area to tune into that. There's also the importance of advice on how to publish. There's been a lot of, I suppose, debate and discussion at the earlier parts of the pandemic on the rush to publish. And while people were doing it for the right reason, imparting information on us, there are quite a number of retractions on areas of treatment and prevention. So listening to what the experts say about this is really important. And lastly, I would certainly encourage our trainees to tune in and really keep, I suppose, give themselves protected time and really engaging with the whole process of the meeting. It is an opportunity for our headspace to sit down, to really learn from the experts in many, many areas. The talent that we have coming to speak is huge. And it is an opportunity to link in with them, to network with them, to ask them questions that are important for caring for your patients where you practice, but also being able to critically think about areas that are important in your, I suppose, education and training. So I would strongly encourage you, hopefully, next year in 2022, we'll all be able to meet in person again and do so safely. So please consider spending as much as you can time-wise from July 9th to the 12th, 2021. Keep the time aside, block out your calendars, try to avoid the other distractions of work. We all do need some time to spend really learning and continuing to learn, not only about COVID-19, but importantly about areas outside COVID-19 and how our research and new knowledge that we have gained from COVID-19 will impact positively on better outcomes for other infectious diseases. Look forward to seeing you there. Thank you.